Thanks for joining us here on 90s Plus. I'm Chris Bianchi. A shot known for effectively inducing rapid weight loss could soon be available in pill form. Ozempic and Wegovy shots might be available in pill form in the not-too-distant future, and I have to look down my paper because I will be transparent about this. Dr. Payal Kohli, our 90s medical expert, who's going to speak with us more about this. I have not heard a whole lot about this, and when you brought this up as a topic to me, you might have well been speaking a different language to me because I had not heard a whole lot about this. But can you start things off by telling me about Ozempic and these Wegovy injections right now, how they work and how effective are they?
You know, it's interesting, Chris, because we discovered this sort of by accident. We were looking for a diabetes medication. They had designed a diabetes medication. They were testing it in the diabetic population. And these medicines change the way the satiety works. They change the way hormones are released after we eat, which can affect, obviously, how our stomach empties and so on and so forth. So it can, of course, change the blood sugar in diabetics. While they were studying it for diabetics, they saw the weight just melting off of people. And they said, hey, wait a minute, maybe we're onto something here. And we often see this. This is what's called off-target effects, that a drug is designed for one thing, but we realize it's maybe doing more than one thing, or it's better at doing something else than what it was originally designed for. So then they went on to study this in the obese population, people who have elevated body mass index and have health-related problems as a result of their obesity, whether that's high blood pressure or sleep apnea, high cholesterol, other such problems. And they found it was incredibly effective at getting that weight off. So this has really done a few things for medicine. The first, it's changed our philosophical approach to obesity, which always used to be, hey, get off the couch, exercise more, eat better, and this is a you problem. Now we've realized it is an us problem. It is part of the medical system's responsibility to provide resources, including medications, that can help patients who are struggling with obesity, unable to, despite diet and exercise, get that weight off, so that we can actually treat it in a medical way, label it for what it is, and help those individuals turn their life around.
So as somebody who's admittedly not educated in this, my experience has been that every 3-4 years we hear about some sort of miracle pill that's going to solve weight loss, and then it sells a bunch and it goes away. This sounds different from that, isn't it?
Very different. And in fact, like I said, it's really turned the entire preventive cardiometabolic community on its head, because we've realized that not only have we found one target, which is the GLP-1 receptor, which was the original Ozempic and Wegovy, we then went on to make something called Manjaro, which was almost like a new and improved version, a software update, or a Tesla of weight loss pills, if you want to call it, which was GLP-1 and GIP. So it had a double target, 2 Gs, so to speak. And that we found was even more effective than the original. Now, just this past weekend at the American Diabetes Association, they presented a triple G version, which is, new and improved Tesla or software update, 10.0, whatever you want to call it. But it's got the GLP-1, the GIP, and it has glucagon. And it can help people lose up to 24% of their body weight.
Wow.
So, Chris, we're talking about a quarter of our body weight within a matter of weeks. That just melts away, on the order of what we were seeing with people who in the past had to have gastric bypass surgery or other types of surgeries in order to get that kind of drastic weight loss.
So is this in conjunction with something else? Is this weight loss? So could you just sit on the couch for 4 weeks and you lose it, or do you have to exercise and eat well?
No. I mean, you always should be exercising and eating well. Of course, any kind of weight loss program involves a comprehensive approach, which is nutrition, which is exercise, which is sleep, which is stress, all of those things. But even if you sat on the couch and did nothing, you would see what we call dose-dependent increase. The higher the dose you're getting, the more weight you're going to get off, with some people losing as much as 30% of their body weight with this triple G formulation.
Unreal.
Within a matter of weeks, in a safe manner. So that's what we're realizing, is that we really sort of stumbled upon a miracle here. Now, we have to be careful, because the original medications were about a 15% weight loss. You can imagine that kind of drastic weight loss, even though it's healthy in the long term, in the short term can expose your body to some stresses, because you're losing a lot of your weight. So you can lose muscle mass, you can have obviously cosmetic changes such as facial wrinkling in other parts of the body. You can get hair loss as a result of dramatic weight loss. You can put people at risk for nutritional deficiencies. And these medications do have their side effects as well.
And speaking of those side effects, what are some of those known side effects?
Yeah, so the way that it works is it works to sort of change the satiety signal from our stomach to our brain. So one of the most common side effects is nausea. because it makes you feel full. In fact, I have patients who take this medicine who say if they overeat on this medication, they will actually physically be ill. They will vomit. So vomiting is another side effect. You can also get constipation or diarrhea, some abdominal pain. It's all working in the gut. Another interesting off-target effect that we have discovered recently, and this is all anecdotal, the FDA hasn't looked at it, the company is not endorsing this, but we're seeing that a lot of people who are taking this medication are saying that their addictive behaviors are turned down. They're not feeling the need to, whether it's addictive shopping or addictive alcohol use or smoking or nail biting or coffee intake, whatever their addiction might be, it actually decreases that. And so there have been some recent studies that have come out about how maybe the dopamine reward mechanism in our brain might not be normal in patients who have obesity. So even after you fix the obesity, their kind of reward system is a little bit broken, hence maybe why their relationship with food could potentially have been altered. Now, we don't know if it's the chicken or the egg, if it's the obesity that broke the reward system or if it's the broken reward system that led to the obesity. But regardless, we're learning just so much about this disease.
You're the doctor. I'm the uneducated one here. Uneducated one's instinct when you tell me all this, too good to be true. Tell me why I'm wrong.
So, well, we do have to be cautious, and I'll say a few things. So first, in animal models, we have seen potentially a signal associated with thyroid cancer. So if anyone has personally had thyroid cancer or has a family history of thyroid cancer, they ought to be careful. Now, the thyroid cells in humans are different than the ones in these animal models that we're talking about, but still, it's a caution. We don't have long-term data. So we don't really know. And this medicine isn't designed to be taken, get the weight off, and then stop. It's designed to be continued, almost like your blood pressure medicine, your diabetes medicine, for the rest of your life. Because the idea here is the underlying problem will sort of recur if you stop the medicine. In fact, the data tells us that 2 out of 3 people will gain some weight back. Now, for some people, that wiring in the brain has been sort of permanently changed. So they're still able to keep the weight off, a third of them, off the medication, but for a lot of people they can gain some or part of it back, and that's a problem. But what are the long-term effects of being on this kind of medication? We don't know that because this is a pretty new medication. It's only been around for a few years and it seems safe for the periods that we've studied it, but what are the long-term effects? And then of course we think about the fact that it's changing our behaviors, our addictive behaviors. How is that going to impact other behaviors, our personality, our general level of happiness? There were some mental health changes in the trials, but nothing that really sort of stood out. But if we start deploying it on a population-wide level, a small signal then starts to get amplified and we start to see more of it. So that's another thing that I would want to explore. And then, of course, the whole issue of cost. These are expensive medications. So are we going to create more of the haves and the have-nots, where we allow the people that have the resources, that have the access to care, to be able to get these medications to lose weight and be healthier, whereas the ones that are underprivileged, don't have health insurance, don't have access to care, won't be able to afford the several $1,000s a month that these medications will cost if you're not insured.
Very expensive indeed, and very interesting as well. What are the possible differences? We're talking also about the possibility of this being an injection to a pill. What would possibly change aside from the fact in terms of how you ingest this pill?
Yeah, so I think that we're seeing similar sort of efficacies and similar sort of safety profiles. So with the injection, it was about 15% with the original injection weight loss. We're seeing that with the pill as well. What would change here is the cost. So it's much cheaper to make a pill than it is to make an injection, storage, manufacture, distribution, what have you. And then, of course, as well, the access because of that. So people would be able to get it. There are a subset of patients who are needle phobic or those that aren't able to kind of inject themselves and what have you. So that would also be helpful to be able to get this into people's hands through a pill form, assuming the pill is safe. Now, there's 3 companies that are currently having a race to have a pill: Pfizer, Eli Lilly, and Novo Nordisk. And Pfizer actually had a formulation that they ended up pulling off the market because it had created liver function abnormalities. So I appreciate the race. I think it's a healthy race, and I think it's going to get us to advanced science. But I want to make sure we don't get too far ahead of ourselves, make sure that we're looking at the safety data with a fine-tooth comb, because when you start to hear 30% weight loss at the highest dose in some patients, you really think you've got a home run, and you just better double and triple check before you start to put it out there. And that's why I'm hoping the FDA looks at all this data very carefully.
Yeah, especially if this is available to the majority of the population, it gets cheaper, and you're hearing 25-30% weight loss. I would imagine that's going to sell like hotcakes. With that said, when could we potentially see these pills on the market?
within probably, hopefully within months, if
Wow.
not under a year. Because a lot of their, especially with the injections, a lot of like the Manjaro and such are already under FDA review, and a lot of the other ones are submitting based on some of the data they've seen. Now they will have to do some more larger trials to have all the pills out there. But again, I want to remind people, this is not a recreational weight loss drug. So it's not I want to drop 10 pounds for my wedding, or I want to get into a bathing suit this summer and I'm going to get on this medication. This is a clinical obese patient whose obesity is a threat to their life. It's a disease that's causing other diseases and impacting their morbidity. And this is somebody, who needs to talk to their doctor about whether they're an appropriate candidate. So don't, just use the medicine recreationally. Don't just use it to get a little bit of weight off. That old-fashioned way is still the best way to get that weight off. If you think you're a candidate, go talk to your doctor, because it may require you bringing up the conversation, not the doctor, to actually think about this medication, but make sure that you discuss it with the physician first.
Good advice as always. Any final thoughts, concerns about what we're seeing here? Because this is fascinating.
I'm really excited to finally acknowledge obesity as a disease, not as a failure of an individual. But having said that, again, I want to make sure that the momentum doesn't sweep us away, that we as physicians, we as human beings and citizens, look at the data very objectively and take a very guarded and careful approach to how we're starting to roll this out in the population. And we often do this in medicine, Chris. We start with the patients that are the highest risk for some new therapy. Then as we get more familiar with the therapy, we start to put it in lower risk patients. So I would say it's very similar when it comes to this. We think about the people who have extreme obesity, whose obesity is a threat to their life. Those are the perfect candidates for this. As time goes on, we are going to start to probably push that needle down and see if it could be part of a way to maintain healthy weight. This is also medicine for diabetes. So that's the other good thing about this, is if someone who's obese and have diabetes, then this is kind of a very solid medicine, in fact, recommended in the guidelines. And what we're also seeing is patients with heart disease, even if they don't have diabetes, would benefit from this medication. So it's really, again, we're starting to see lots of different applications, but we want to be sure to be careful in our approach.
Very interesting indeed. So we'll hear, I would imagine, more about this in the coming weeks, months, probably years. So
you will. Just Google it and you'll see a bazillion hits.
I had to do this for this segment here. Again, maybe I've been living under a rock, but I really had not heard about this at all. But this is beyond fascinating. So thanks for enlightening me, and also for enlightening our audience about this, Dr. Payal Kohli, 90s medical expert. Thanks for joining us for a bit more about this.